Lawmakers squared off with the HHS Secretary Robert F. Kennedy Jr. in a pair of tense hearings on Capitol Hill today. Kennedy's actually capping off a marathon 7 appearances before Congress in just the last week. Most of them, at times, have devolved into heated exchanges on everything from vaccine policy and measles outbreaks to a scrutiny of a proposed budget that would make deep cuts to the nation's health-related spending. It comes as CNN has learned that aides to the president have sought to rein in Kennedy, according to these sources, on efforts to overhaul vaccines ahead of the midterm elections. Now, multiple senators today pushed the HHS secretary to clarify his own history of vaccine skepticism.
I'm real curious if you're going to include funding a coordinated vaccine education and distribution campaign, for example, countering misinformation about measles and the MMR
Tell me one piece of misinformation I've ever said. One statement, just one.
If I could continue, Mr.
You
Secretary.
say you have a list of them. Read one.
Tailoring outreach to communities with declining vaccination rates as well, measuring whether those campaigns are working.
You're just making things up, Senator. You're just inventing stuff.
Are you taking the position, as your CDC director has taken, that the measles vaccine is vital to keeping American children healthy in this country? Are you taking that position today? That has not been your position.
That's my position. We promote the measles vaccine.
I hope you will go out to America and promote this. The idea that you have nothing to do with this.
The measles vaccine prevents measles in 97% of the people who take it. I've always said that. That's what the science says.
Ooh. My source tonight was part of that tense exchange with the HHS Secretary. Democratic Senator Michael Bennet of Colorado is here. Senator, what did you make of what the Secretary said to you there?
Thank you for having me. I was shocked. I mean, the guy has spent his entire life peddling conspiracy theories, saying that vaccines are going to damage children. And today at this hearing, he said that he had an epiphany, I guess, and that measles vaccines and flu vaccines, by the way, were also safe. And it's a little shocking given the fact that this year we've seen more children die from flu than in any year in modern American history. We've seen an incredible increase in measles, you know, the biggest increase we've seen for 30 years. And I think he's responsible for a lot of that.
Well, I mean, people listening to that might have watched, a lot of the angry and tense exchanges that often happen. But he has not really gone that far on the measles vaccine. But from what I've looked at his past comments when he's testified, he
never has. And I wonder whether he thinks that it's finally an untenable position now that it's been exposed more broadly than just on the. So
you did see that as a shift?
He goes to. Definitely saw it as a shift. Yeah, he's denied it all the way through. And with the question I asked him was, do you agree with the CDC, the Center for Disease Control head, who says that vaccines are effective and kids should be vaccinated? And he said yes. Now the job, I mean, I think the guy should resign, Kennedy, and I've said that for a long time, because the misinformation that he has sent out to America has meant that moms and dads have been really scared about whether to get their kids vaccinated, whether their kids are going to be safe in school. These are things we took for granted before he showed up, and at least for 30 years we've taken it for granted. And now he's raised a huge question about it. So
I mean, even some Republicans were saying the guidance was confusing. John Barrasso, obviously a doctor. Right. When he testified today that the next CDC director who's been picked, the nominee is Dr. Erica Schwartz, is the new selection from the president. He said that she will be able to make decisions independently. Do you believe that that is true?
I don't see any reason to believe that will be true, but this is a good role for Congress to play, to provide oversight, to make sure that they're doing what they need to do. His position on these vaccines was completely unsustainable, but it's a shame that it has taken this long for us to force him to make the right kind of statements in front of the public, but maybe this is progress.
Will you support her nomination?
I haven't decided yet.
Do you need to hear from her, or what are you weighing?
Yeah, I'll need to hear from her. I'll sit down with her and hear how she thinks about this. I mean, one of the things you need to ask these people is, are you willing to tell the president the truth? Are you willing to tell Secretary Kennedy the truth? What would you resign over? Or do you have to subscribe to their fake science to be a successful nominee or appointee? Those are the kind of conversations we have to have.
And we saw, how critical the CDC director role is during the pandemic. In terms of COVID-19, sources tell us that HHS blocked publication of a study that showed COVID vaccines actually cut ER visits in half, visits and hospitalizations roughly half last year. We're told that the current head of the CDC who's running it blocked it from being published in a journal. We heard from HHS that there was concerns in the article's approach, but what do you make of
it sounds to me like they're hiding stuff that the public should have. That's great reporting, and we should follow up on what you guys have figured out, because the public needs to know this. I mean, even now there's so much residual misinformation about COVID, and we haven't recovered fully in some ways as a society from COVID. And I think it will only help us do that to be able to understand what the facts actually are.
One thing that has gotten praise from some people who might typically criticize this administration is the Trump RX. There was an exchange that happened today with Secretary Kennedy about how much drugs are actually costing.
Secretary Kennedy, do you know how much it costs for a 30-day supply of that drug at Costco?
But I would say this, Senator.
Do you know what it costs?
President Trump has a different way of calculating.
Do you know what the drug costs at Costco?
I do not.
The drug is $16 at Costco. Trump RX charges $200 for Protonics, and Costco charges $16.
Will you commit to releasing your written agreements with the pharmaceutical companies tomorrow?
No, I will not, and I can explain why. Those agreements contain proprietary information and trade secrets.
You're one of the Senate Democrats who wants that information public as well.
We definitely want it public, but Caitlin, let me also say, this is such a small debate right now. America needs a new healthcare system. The healthcare system that we have costs twice as much as any other industrialized country in the world. It doesn't cover everybody. It doesn't give our kids mental health care. It doesn't allow us to afford drugs the way they can in the other countries we're competing with around the world, and we're dying 6 years younger than our competitors. That is insane. I believe the American people want us to have a universal healthcare system. I believe they believe healthcare is a moral right that we should have. And I'm talking about Democrats and Republicans. I think the debate has shifted way beyond where it was during the Affordable Care Act. And I think that's what we should be fighting for as a nation, instead of kind of nibbling around the edges, which is what we've been doing here for a long, long time.
Senator Michael Bennet, thank you for joining us tonight.
Thanks, Caitlin. Thanks for having me.
To do so.